From San Francisco State University, this is the Nursing 706 Leadership Project. This project was created by a group of first-year nursing students to understand and apply leadership concepts to real-world situations. I'm Christopher Duldulao. For the past week, my team and I have been investigating the shortage of nurses in America, more specifically the retention and recruitment of nurses in their current jobs. All too often we hear that the U.S. has a shortage of nurses. But why? Where could they be? Are they leaving their profession? Changing their occupation? Changing their identity? Today we'll be focusing on some of the reasons for this nursing shortage, how it affects healthcare, and what is being done to bring our nation's amount of nurses back to a healthy number. According to the American Association of Colleges of Nursing, or AACN, the United States is constantly faced with a growing need for healthcare, while the supply of nurses in areas of most need continue to dwindle. Current estimates project that by 2030 we will have a national deficit of close to 1 million nurses. This deficit has been an issue for at least the last decade. However, the problem seems to be exacerbated by the 75 million baby boomers who will soon fall into the old age category. In fact, caring for this retiring population alone calls for the need of at least 400,000 healthcare professionals within the next few decades. According to one report, the author suspects the demand for nurses will rise about 2 to 3% each year without intervention. The significance of this current and projected shortage are as follows. All studies on this shortage report a disproportionate ratio between nurses and patients. This leads to a high patient load, which we'll get into a little bit later. This ultimately leads to an inability to provide proper health care to patients, which, as most can imagine, does not bode well for the image of health industries. And furthermore, in another article, the author notes a refusal of patients to nursing homes due to understaffing of RNs. While this may seem like a minor concern compared to the need for nurses in acute, critical care settings, we have to keep in mind the aging population who will be needing the service of nursing homes in the not-so-distant future. By now you're wondering, how did it get so bad? Without going too in-depth, let's first explore some related but contributing factors. Many authors cite the low wage and poor public image that is associated with nursing. It seems altruistic pursuits for becoming a nurse may be trumped by financial reasons and maybe even vanity. In addition, according to Clark in 2010, future students lacked the opportunity to pursue nursing education due to the lack of space and clinical sites in institutions. Furthermore, in regards to academia, older nurses are reluctant to accept positions as professors due to the unattractive pay. With money on the mind, some who are already nurses who aren't content with their profession end up changing careers unrelated to nursing at some point in their lives. These poor educational structures in place for nursing students, coupled with the prospect of more lucrative career alternatives, are designed for the demise of the nursing profession. Moving from the related factors, we will take a close look at some specific evidences that turn nurses away from their profession. One commonly cited complaint is the lack of administrative support, which also affects the growth of new nurses within a company. These are considered an environmental issue. Another evidence of the nursing shortage is the complaint of stress, increased physical demands, and patient load, or the number of patients a nurse is responsible for. This represents a combination of an environmental and internal issue. Both lead to job dissatisfaction, which ultimately encourages increased attrition rates within a facility. To illustrate the evidence of the issue within the environment, I caught up with a colleague who works as a pediatric nurse. To protect his job and identity, I will call him Mr. B. Mr. B had a lot to say about his current job.
Almost daily, I struggle with support from our management team and our physicians. The doctors will expect me to perform tasks that are very specific, things I've never learned before. Not only that, but I'm expected to do the work of 3 nurses. When I object or have questions, then I'm relegated to tasks outside my scope of practice. I've complained to the leadership team before, but have been dismissed. They say there's nothing they can do for me. I think this will be my last month at that hospital.
Mr. B isn't alone in feeling the way that he does. In a survey of 415 nurses, one research study found that up to 82% of respondents feel an increasing need to leave their current position as nurses due to their management team. To remedy this poor engagement between management and staff, the leadership team must focus on increasing the satisfaction of their employees. One place to start is by having healthy communication. According to Huber, the author of Leadership in Nursing Care Management, healthy communication must be timely, accurate, and open. In Mr. B's case, his orders were not always clear and was expected to perform tasks outside his scope of practice. Had his orders been communicated properly, he wouldn't have had such a difficult time understanding his superiors. Another item the pediatric team can focus on is shared meaning. According to Huber, shared meaning are the assumptions of one another that are not well defined. Mr. B and his team can have more outlined, definitive roles so that they know what is expected of each other to ultimately increase the performance and outcomes of his unit. To illustrate an internal issue, I followed up with another nurse colleague, Miss C. Again, this is to protect her identity and job.
I currently work in the emergency department, but that might change soon. As you can expect, we are always busy. We see some of the most gruesome, tragic cases one can imagine. It is difficult to care for some of these patients because some are on the brink of death, and you can't help but feel sorry for them. What's worse is that your job doesn't end when your shift is over. You carry those feelings home, and it bothers you for months. At this point, I don't think nursing is for me.
What Miss C is experiencing is compassion fatigue and possible burnout, and is fairly common. According to a survey done by Sawatsky and Enns in 2012, 26% of emergency department nurses consider leaving their department in the next year. Even more are considering leaving the year after. There isn't much a leadership team can change about the nature of the emergency department. However, according to Sawatsky and Enns, the leadership team can focus on specific items to retain their nurses. They recommend implementing professional development activities such as encouraging higher degrees. They also recommend establishing relations with non-nurse personnel in the emergency department to share a type of camaraderie with their coworkers. Lastly, Sawatsky and Enns suggest hospitals increase staff and resources to address burnout among the nurses. To address the related factors that prevent people from becoming nurses and to prevent current nurses from leaving the field, the following are some suggestions. According to Clark, a nurse can solidify his or her professional identity to enhance his or her public image. One way this is achieved is through working in the public, such as public health nursing or as a health advisor within politics. This not only exposes the nurse to various areas where he or she might be needed, but secures his or her sense of competency as a nurse. Another item nurses can focus on is higher education. According to Rich and Nugent, nurses who obtain higher degrees in nursing feel they are more competitive and desirable in the job market than they were before. Lastly, hospitals can adopt career ladders to retain their nurses. If there is opportunity for growth within the department, nurses will find meaning to stay and will feel valued as they move up the company ladder. To conclude, nurses have their own reasons for leaving the nursing profession. Not only that, but people are reluctant to enter the profession because it doesn't seem glamorous. Change can happen on various levels. First, leadership can employ different techniques to retain their nurses. These techniques, as discussed, include having open communication, addressing issues such as burnout, instituting professional development, and adopting a career ladder. On a personal level, nurses can aim for higher education and use their skills in a more public setting. This in turn increases their exposure, which will hopefully draw people into the profession. This concludes our presentation on the nursing shortage. Data was gathered, checked, and rechecked by group members Brian Collins, Clara Davis, and myself. The presentation was put together by us three as well. Music is by Bad Dream, and the references are listed at the end of this slideshow. I'd like to thank you for listening.